Did you know there is a term called functional depression? Well, yes, functional depression is actually clinical depression in mild to moderate degree, but these are in patients that look perfectly normal on the outside. But internally, they're fighting with sadness, loneliness, self-worthiness, this fatigue, but they push themselves to do their daily chores and activities, and they excel very well. They could be among the most successful people around you. This is called functional high depression. Functional depression is very important. High functional depression, you may be dealing with your busy life, dealing with the family, the kids, the work, the business, the aspect, your boss. You may go through cycles and up and down, and these symptoms may not manifest themselves because you're pushing yourself very clearly through those symptoms. Now, some days you may not feel right, you don't want to go train, you may not feel right, you may be tired. But if you keep pushing yourself consistently through functional depression, there's an increased risk of burnout. And that burnout feels like you just don't want to do anything. You're just exhausted. I've had it. These are symptoms of high functional depression. It's very common in those patients to keep pushing themselves over and over again until they burn out. Usually these symptoms are not very obvious, but they become more obvious if they last longer. It's tricky with functional depression because the symptoms are not obvious and they're chronic low levels of depression consistently over time, unlike moderate to major depression because you classically see them. Functional depression is more long-term, unlike regular depression could be more short-term. Therefore, you really want to talk to your primary care doctor or your specialist or your psychologist to find the underlying problem to address those conditions, because a healthy mind is everything.